Hello everyone, I am Trudy-Ann, a senior nursing student at Roberts Wesleyan College. I am completing my capstone requirement here on WCC 7. As part of my capstone requirement, I am doing a nursing impact project. My project is addressing pain management with interventions of music therapy and exercise with emphasis on yoga and how that can alleviate pain and distress in the patients here as opposed to chronic use of opioids. Some background information on why this is important to me and to the nurses, to nurses in general. Oh, before I go ahead, happy Nurses Week to you all. Now, we know that chronic use of opioids may lead to dependence, tolerance, and addiction for individuals. Chronic opioid use, also slows the GI motility, and this causes constipation and other issues of clearance for excretion of medications and foods that is presented to the body. Now, knowing that the patients that are seen on this unit already have some illness in their body, slowing down their motility rate increases the risk for buildup of toxins in their body. And this is something that we do not want to do for these patients, especially knowing that the patient population here on WCC 7 are neutropenic and the infection is something that they're exposed to already. Now, within the research that I did for this project, evidence shows that there's a higher risk for symptoms of withdrawal when patients are treated with opioids. One research article that I looked at advised that before beginning therapy, depending on the patient, this is because each therapy that we introduce with patient is patient specific, right? But before the beginning of therapy, this therapy would include chemotherapy or radiation. If there is the use of music therapy and exercise with emphasis, as I said before, on yoga, the patient outcomes are more improved such that pain management does not have to include a high usage of opioids. Patient will not feel as much anxiety, depression, or feelings of distress. We know that anxiety and depression is something that outside of oncology patients, it's something that affects every disease or illness areas of life. Right. So if we address these, like pre-medicate these with music therapy and yoga, then patient outcomes will be more improved. We can see better outcomes at the end of treatment, right? As part of a handout that I provided, it shows also specifically, which is something that I was very taken aback by, that the chronic use of opioids for pain management can cause something called opioid hyperalgesia. Now, that means that when a patient is medicated so much with opioids, they develop one tolerance, sensitivity, such that when they are medicated with let's say a dosage of 5 milligrams, that doesn't do anything to the pain. Now, in treating our patients, we know that you start low and go slow, and then you build up for a therapeutic level. However, for patients who are chronic or experience chronic pain, when they are treated with opioids or a chronic treatment of opioids to manage that pain, there's so much sensitivity to that. Personally, I am sensitive to anything that has to do with opioids or medication therapy for pain. I have a high pain tolerance level. So, I mean, like I can go like real high before getting something. And then if and when I do get medication for pain, it's almost like it has no effect on me. So I can speak or testify to this. Now, one thing that was specific in getting the information for this assignment was the gaps in research. Now, most of the articles that I looked at, they dealt with pain management and for the cancer patients, or the patient population that they dealt with was more for patients with breast cancer. There was limited information or research information regarding patients who had solid malignancies like head or neck cancers, cancers in the trunk. Most of the evidence spoke to, like the yoga therapy, spoke to patients with breast cancer. Another gap that is in my research and in practice is that our nursing population, we lack education on how this can improve the patient's outcome. As part of therapy, when a patient is on the unit or in hospital, um, we know that there's pharmacological interventions that we do for their illnesses. However, if it was embedded in our treatment, in our nursing plans, care plans, or in our treatment, that there is an involvement of exercise and music, limiting the use of opioids to alleviate pain and distress, then that would improve on our patient outcomes. Number one, reduce their distress, and also reduce the amount of opioids they're given to treat their pain and distress. Another gap in research is that large scale research, total large scale research, is not done on how we can manage the pain and distress for our cancer patients, as opposed to just using the narcotics. If there is more research, if there is more nursing interaction, and looking at how we can alleviate the distress that they're feeling, and not be so dependent on the usage of opioids, then we will reduce the amount of patients or individuals that develop dependence, intolerance, and addiction, as well as reduce withdrawal symptoms after their use of opioids. Now, here are just a few suggestions for practice. While we are here on our unit, or as part of when a new nurse comes in, I'm suggesting, or with the research that we have collected, it's suggested that nursing education be given for CAM therapy or alternative measure therapies. If this is done as part of as an ongoing process, then we are able to look at care plans or treatment plans that will include all aspects of the patient's well-being. Providing holistic care to our patients, mind, body, spirit, not only can be derived from, making sure that they have no pain or a little bit of pain or tolerable pain. It's just making sure that within themselves they feel human. They feel like their needs, their spiritual needs are addressed. Their physical needs are addressed. Another suggestion, I know this is something that we talk about every day, patient-staff ratio, but with the ratio of patient to staff, safe ratios, and nursing care that will allow for a nurse or provider to spend more time intervening in using these methods, it will help our patients, it will reduce their use of opioids, and it will overall improve their outcome and our sense of completing something that's justifiable for the patients. Also, on this, in research, there must be more research that we can do to find out how these alternate therapies can help with our patient population. There needs to be more research. We need to do more about doing that for our patients instead of just loading them on with the opioids. I have a lot of distress. I have a lot of distress when I am treating patients with opioids, because I do believe that there are other natural therapies that we can use to relieve their distress, their anxiety, their pain. I wish sometimes that while I'm in practice, I can spend more time with the patients, you know, jazzing, playing music. I think that should be something that we introduce into practice. It should be a part of nursing care plan that, at least sometime during the day, the patients are placed in an area or even within their rooms where they can exercise, listen to music, something that calms their spirit, takes away the distress. Because it's mind over matter sometimes. It's mind over matter. They don't have to be treated with opioids at all times. All right. Another suggestion that I have, which I've seen, there is an area on our unit that I think can be utilized for this exercise therapy. I do understand that sometimes it can be like problematic to have that fixed. However, because I am so I think that these interventions will help with the patients if there is some place that's situated where they will go for guided therapy, music and exercise, just some stretches, something to remove their take away their anxiety that they're feeling regarding their disease prognosis or treatment plan that they're on. If we just have that built into their treatment plan, not just pharmacology, then I'm sure that there's so much more that we could do to alleviate dependence, addiction, and tolerance. In closing, I would just like to say that if we incorporate these, there are a lot of pictures here that have a little information on them, but if we are more detailed, if we are more purposeful in our treatment, if we are more guided by alleviating what is really causing the pain, what is really causing the distress, and not just putting a band-aid over it, then will have improved outcomes for all our patients, regardless of how advanced they are in their disease progression. Thank you for your time. Have a good shift.